Welcome everyone. This is Dr. Jaitly from New York, your cardiologist on your favorite website, MuniMeterHealth.com, where we are educating our medical fraternity as well as, of course, the general masses, because my initiative of some 35 to 40 years here has always been combining patient health literacy to the clinical continued medical education in order to enhance the clinical outcomes. So thank you again for associating with MuniMeterHealth.com and across the globe and furthering my cause of spreading the knowledge freely to all, to one and all. And thank you again for being on MuniMeter. Now, today's, without any further ado, I'd like to do some housekeeping quickly, and that is, this is purely an educational tool. It's not to be taken as a treatment advice, one. And two, for medical fraternities, especially the residents, students, fellows, and the exam-going, students, I always say, please consider this as a supplement and not as a text. Okay, so let's now delve into the subject matter. The subject today being, how do you calculate the stroke volume and therefore the cardiac output by echo? Okay, that will be very interesting, hopefully, and we'll try to do a quick short video here for you. So, assuming that the heart, we are looking only at the left ventricle, just mind you. Here's your left ventricle. And if you will, your aorta will show the aorta something like this. And obviously, this is your left atrium. So, the left atrium is pouring blood from here. And this is, just remember, it's a schematic. And then as it's going up here, it's going via the cross-sectional diameter of the aorta, and the entire aorta is getting filled per beat as stroke volume, if you will. Now, how do you calculate that by echocardiography? It's a very, very simple technique, actually. So what you do is, assuming that the heart is actually, it's more elliptical and almost, some people have defined it as like a half a bullet. So it's more like in this fashion. But regardless, we have to look at the aorta, which is cylindrical. So now we know by our very old geometry, the formula has been pi r square h. If you look at the pi, which is 3.14, that is always a constant. R square will be your diameter of the aorta. So this will be your diameter of the aorta, if you will. So you could measure that very easily by echocardiographic calipers. So take the diameter and divide that by 2 will give you the radius, and then have that squared. And the h is the key now. Now h becomes your VTI. We call it velocity time integral. Now this is measured by a doppler mechanism. So far this is a little less tedious, but this becomes a little tedious, but you have to be very careful. Now let's see how we do that. Okay. So remember, when you're calculating the stroke volume, you're doing it on the chest, obviously. The heart is, say, sitting, let's use a different color quickly. Heart is sitting here. And when you're doing, this becomes your apical view. So we're not going to use the apical view. We're going to use the long axis view. And the long axis view will give you this, this measurement. And the view will look like more like this, if you will. Let me just quickly draw that as well. Here's your aorta. These are your aortic valve leaflets. This continues as a septum. This becomes your posterior wall, and here is your left atrium, right? And the valve leaflets of the mitral valve will be somewhere here. We'll show it in a different color. Now, the blood actually traverses in this fashion, so that for the students and fellows, it's very clear. This is your left atrium. I'm just labeling it. This is your aorta. This is your septum, and this is your posterior wall. So from left atrium, it's going down into the LV, and then up into the aorta like that. Okay, so each beat it's circulating in this fashion. Now this is your long axis view, correct? As you see it on the Doppler. So what's happening is now each time the heart empties from left atrium into left ventricle, that left ventricle later contracts fully and sends the blood up in the aorta. Now as it's traversing up, you want to take the Doppler. Now remember, you want to take the Doppler right at the level where the aortic valve leaflets are fully closed. So it's the end systole. Okay, so it's very important. You want to take this because that will be the full volume of the entire velocity of the blood that has gone up into the cylinder here, so-called the aorta. If you take it at the opening of the aortic valve leaflets, that's the beginning of the systole. So you don't want to take that because that may not be the peak. So we want to really record what it looks like is a velocity time integral in this fashion. And as the Dopplers are being recorded and you click at that level, mind you, you might get some weaker signals here and weaker signals here. You don't want to take that, so those will be disregarded. So disregard these, but take the darkest signal, which is the biggest signal, I call it, and that becomes your VTI, and that's in centimeters. Okay, so the VTI times your CSA, which we just calculated. Remember, this is your CSA, your cross-sectional area. The cross-sectional area is pi r square. Okay, so cross-sectional area times VTI will give you the stroke volume that is going up here. Very simple. So stroke volume, let's do it again. Stroke volume is CSA, which is your cross-sectional area of the aorta right here, okay, times the VTI, which we just calculated by the Doppler. So cross-sectional area is calculated by the 2D echo. VTI is calculated by the pulse wave Doppler. Remember, you have a pulse wave Doppler here at the long axis view, and that is very important. Okay, so as simple as that. So CSA, say you have you've calculated that, and the VTI and the stroke volume will be about. So stroke volume normally is about 80 cc's, 80 ml from the left ventricle, and your heart rate being about, say, 70. Your cardiac output therefore will be 5,600 ml and vary from 5.5 to 6 liters, which is normal. Remember that. So this is per minute, because now you have calculated the cardiac output in a minute, because the heart rate is 70 times its beating. So every time it's ejecting about 80 cc's, which you just calculated based on this equation. Now, this equation is very important. By the way, this will be on the boards for the cardiovascular fellows and, of course, third-year residents if they want to really aspire to become cardiologists. All right. And of course, for my colleagues, just to brush up quickly, I've given this spiel here as to how you calculate, because time and again, we always forget these equations, but normally our technicians are very good about calculating it, but I think it's a good idea to always double check, and this way we have a good idea about what the cardiac output in that individual is. Okay, great. So this is, in a nutshell, how you calculate the CSA and the VTI, and therefore the stroke volume, and therefore the cardiac output. All right, having said that, so long, and stay tuned for another short video coming up on MuniMeterHealth.com. So long, this is Dr. Jaitly.